To close out PrimaryCare24, I want to invite from one of our collaborative organizations, the National Association of Community Health Centers, Dr. Kyu Rhee, to give some reflections and call to actions as we wrap up this meeting today. Kyu.
Thank you so much. In terms of a wrap-up, I reflect on how much I've learned, not only in these last couple days, but also in general, the great work in terms of primary care for America. And as a primary care doc, you learn a certain skill set, and you want to manage and support your families and your patients that you treat. And I've got some pictures up of what I was fortunate to do as a primary care doc. But ultimately, you try to simplify those challenging issues of disease, the pathophysiology of disease, into ways that the people you serve can understand, and you can see how they can take actions to help improve their health and help improve the health of the community. And so as I reflect on the complexity of our health system, which in many ways is the challenge we face in finding ways to look at our health system and find ways to create simplicity from that complexity so that stakeholders like those in this room and stakeholders who are online can consider ways in which we can make sure that our value-based care transformation is values-based with primary care as the foundation. I just want to highlight that as a key piece. I would be remiss if you go to the next slide. I think of it like my first day in medical school. I learned about chief complaints and problem lists, and in some ways I think the problem lists we have in our nation, where I believe primary care is the solution, is that we have a sick care focus. We have a crisis in terms of our primary care workforce, and that's the whole team. We have horrible health disparities, especially in geographies like rural, frontier, and urban and island America. And we've got this innovation dilemma because we actually have a solution that will work, but ultimately we have this challenge that the system, in many ways, despite these innovations that we see in primary care, is resisting the ability to make sure we value it more, that 5 cents gets much higher, that 5 cents controls the remaining 95 cents. So you quickly look at this, go to the next slide. That challenge is significant, the money we spend versus where it needs to be spent. Next slide, sick care. The fact that we have 100 million Americans who have lack of access to primary care. This is a very significant challenge. The fact that we're only spending 5 cents on the dollar or 4.7 cents on the dollar on primary care is a big problem. Next slide. The fact that we have health disparities. 1 in 3 Americans are below 200% of the poverty level. And so while I'm grateful, I was just in Vermont and I know West Virginia, these are sites that have health centers that serve 1 in 3 Americans in those communities. But ultimately, we have so many people who are suffering the crisis of what I know as a primary care doc, lack of access to vaccines, cancer screenings, chronic disease management. These are all things that save lives. And ultimately, we have a solution to help address this, especially in disparity communities, but we have a lack of access and investment in primary care. The last slide here, in terms of the problem, is this innovation dilemma. As I say, I think the simplicity, what I believe strongly, is what motivated me to become a primary care doc, is to recognize that ultimately primary care is the solution for what our health system needs. But the challenges in tech and health tech and value-based care, it really highlights the fact that we have the solution, but we have a system that in many ways is trying to figure it out, but ultimately we're not achieving the actual outcome that our country needs, that our nation needs. So if you go to the next slide, those 7 C's are important. I love the 7 C's, and of course continuity, the relationships, and comprehensiveness, which is a broader team-based approach, being community-based, and being cost-effective. But if you go to the last slide here, I love health centers, so I gotta put a shout out. I do think they're the best, but I know there's other parts. We want everyone. Primary care is the best. Next slide. Next slide. I think we're the most diverse and most resilient and most innovative part of the system. That's my shout out to health centers as the largest primary care system in the nation. But I want to highlight this opportunity, and I referenced the 7 Ps earlier, the fact that we have to think about all these complex stakeholders, from patients to providers to payers to purchasers to policymakers to producers to pioneers. And I want to put appreciation and gratitude to Primary Care for America, Sean Martin, and his team here, to have the leadership, to have the courage to bring this coalition together. And for us at NAC, the National Association of Community Health Centers, being a founding member, we are on a journey and we're ending about 3 years of this journey. But it's so important now as we look ahead to the future for the next 3 years that we work together and think about how we can be bold about assuring primary care for America and the importance of us working together as members and diversify this coalition across those 7 Ps and way beyond. Because ultimately what we need now for our nation, for our communities across the nation, especially those that are suffering from health disparities, is primary care. So please join us as we think about this for the next few years and join this movement together. Thank you and gratitude for all of you who are participating in person and online on this effort. Thank you very much.